Can you get rid of or prevent crow's feet? Let's talk about it. I'm Dr. Sam Ellis, and I'm a board-certified medical and cosmetic dermatologist in Northern California. I'm here to help you understand your skin and find products and procedures that work for you. So if that sounds good, give this video a thumbs up and don't forget to subscribe to the channel. In this video, I'm going to talk about ways to prevent crow's feet, but I'm also going to talk about products and treatments you can do if you already have them, so make sure you stick around for that. If you clicked on this video, you probably already have an understanding of what crow's feet are, but in dermatology, they are also known as lateral canthal lines. They're the little wrinkles that emanate from the outer corner of your eyes. And when you're younger, when you smile, you almost barely see your crow's feet. But as you age and as time goes on, those crow's feet can become more prominent. Early in life, crow's feet are only something you see when you animate. So when you smile or when you squint, you see that skin around the eye contract. But as you get older and as you've smiled or made certain expressions around the eyes for many years, those crow's feet start to get etched in so that even when you are not animating your face, so your face is at rest, you can see those crow's feet wrinkles around your eyes. Now, crow's feet are pretty much inevitable. If you move your face and you animate, you are going to get them over time. However, how deep those crow's feet are and when they start to really show up and maybe when they start to bother you is going to depend on a number of factors. Your genetics, of course, are going to play a huge factor, not just because that affects the quality of your skin, but it can also affect the general shape of your face as well as the intensity of the movements you make in your face are. That's going to determine how quickly those lines get etched in and how big those lines become. Not only does the integrity of our skin change over time due to environmental insults as well as intrinsic aging, but the entire anatomy of our face changes. For example, the bony structure of our skull that supports our face shrinks over time. In addition to that, the ligaments that help hold things up and help things stay in the right position tend to loosen and fall. This makes the overlying skin more prone to wrinkling and creasing with regular movements. I will often use the table and tablecloth analogy for my patients to explain this phenomenon. So if you think of your skull as a table and the overlying skin as the tablecloth, when you're young, you have a really nice big table, a nice firm skull, and you have a nice tight tablecloth or layer of skin that fits on top of it. As we get older, not only is our table or our skull shrinking down, but the overlying tablecloth is getting worn and stretched so that as time goes on, that tablecloth no longer fits the table and it starts to have more creases and wrinkles in it. So when we're thinking about cosmetics or anti-aging procedures, we are often thinking about interventions that affect the skin or that overlying tablecloth to keep it fitting as well as possible. Now, before we get into the various interventions to both prevent and treat crow's feet, I do want to make it very clear that the goal is never to eliminate crow's feet entirely, okay? Like, we want you to look warm and genuine when you smile, or when you animate, we want to be able to tell what emotion you are trying to convey. However, we don't need our crow's feet extending from the end of our eyes all the way to our hairline to convey those emotions. So the goal with myself and with my patients is not to be eliminating lines or preventing them entirely, but softening features over time so that we are still aging, but in a more graceful way. And more importantly, not changing the core of who we are or what we look like. Tip number one when it comes to preventing crow's feet is sun protection around the eyes. The skin around your eyes is the thinnest skin on your body, and it is the most susceptible to showing premature signs of aging, primarily caused by UV radiation or chronic sun exposure. And of course, there are a few different ways we can be protecting that skin around our eyes. Number one is sunscreen. I feel like a lot of people fail to apply sunscreen around their eyes or to their eyelids. It is so rare that I watch a skincare tutorial video and see someone actually apply sunscreen there, but it's actually really important. Now, of course, if we are going to be putting sunscreen around our eyes, one of our main considerations is going to be whether or not that sunscreen is going to cause our eyes to sting. And we need to be picking sunscreens that don't cause eye sting. I don't love making blanket statements about skincare products, but I do find that mineral sunscreens tend to cause less eye sting in me and in my patients than chemical sunscreen. One of my favorite mineral sunscreens for around the eyes is the Elta MD UV Physical SPF 41. Now, this one is slightly tinted, so you actually get a little bit of coverage of dark circles if you're also going for that too. It's a face sunscreen, but using it under the eyes can be really helpful. And in general, one thing you can look for on sunscreens is ones that are designed to be used post-procedurally. So sunscreens that are designed to be used on people who've had microneedling or lasering done tend to be really gentle, and stinging or irritation of the skin and eyes is kept a little bit more in mind when formulating those. I personally have also had a lot of success with Korean sunscreens used around the eyes. One of my absolute favorites favorites is the Beauty of Chosun sunscreen. You've heard me talk about it so many times on this channel, but one of the reasons I love it so much is there's no irritation when I use it around my eyes, and many of you have told me that it feels good around your eyes as well. Another Korean sunscreen that I really love around the eyes and have had zero eye sting with is the Haru Haru Wonder sunscreen. I really like this because it's quite creamy, so it almost feels like an eye cream, and makeup goes over it really, really well, so it's almost like a makeup primer too. Now, something that I have found really helpful when applying sunscreen around the eyes if you're trying to avoid eye sting is actually powdering down your sunscreen with a little bit of translucent setting powder that you would typically use for makeup. This can help lock that sunscreen in place so it's less likely to migrate into your eyes and cause issues. Now, if sunscreen around your eyes is going to be an absolute no-go because nothing can be tolerated, there are certainly other ways to protect your eye skin from the sun. Number one is wide brim hats. I like a brim that's at least 3 inches and that goes all the way around so that you're not just getting coverage of the front part of your eyes, but also the sides where the crow's feet show up. If you want some wide brim hat suggestions, I have an entire YouTube video dedicated to UPF clothing and hats that I'll link in the description box. And of course, we can't forget the value of sunglasses when it comes to eye protection. Now, of course, you're going to get protection of the direct under eye with those, but if you find sunglasses that have thicker siding or wider siding, you're also going to get some protection that way. Speaking of glasses, it's not just sunglasses that help with the prevention of crow's feet formation around the eyes. If you have any type of visual impairment that's causing you to squint when you're looking at things that are close or far away, make sure you have the appropriate corrective lenses so that you're not constantly squinting and etching those lines in place. Now, aside from protecting the skin around your eyes, you can also be doing things with skincare to correct the skin around your eyes. When we think about anti-aging skincare in general, one of the most popular and effective ingredients are retinoids. And these certainly can be used up around the eyes to keep that skin strong and fortified so that it is less prone to creasing over time. And there are so many studies that demonstrate that with the consistent use of retinoids around the eye skin, you can reduce fine lines and wrinkles there. If you're already using a retinoid product on the rest of your facial skin, you can bring it up under and around the eyes. However, because that skin is thinner and more delicate, you might not be able to tolerate the same retinoids around your eyes that you can use on the rest of your face. And skincare brands have been catching on to this, so now there are products formulated for use around the eyes that have retinoids in a more gentle formulation. A popular retinoid product to use around the eyes, and one of my personal favorites, is the Beauty of Chosun Revive Eye Serum. Aside from containing the retinoid retinaldehyde, which has been shown to smooth and strengthen the skin around the eyes, it also has niacinamide and glycerin and cholesterol to smooth and soothe the periocular skin. The beauty of using retinaldehyde instead of retinol is that many people will experience less irritation when using retinaldehyde, and they will also experience faster results. Another popular retinoid eye product that some of my colleagues have been absolutely raving about is by Dr. Dennis Gross. Their advanced retinol eye serum not only has retinol, but also has bakuchiol, which is a plant-derived ingredient that has some retinol benefits. The reason I like this serum so much is it's a super lightweight gel, so if you're someone who deals with oily eyelids or you're prone to milia and you only want to be using lightweight products around your eyes but also be using something that's very effective, I think this is it for you. Now, it is worth noting that some people will not be able to use any type of retinoid around their eyes, and this can be for a couple of reasons. One, the skin around the eyes is more delicate and can be easily irritated by retinoids, so even if it's formulated with eyelid skin in mind, it's still not going to work for everyone. Also, some people won't tolerate retinoids around the eyes because it can give them symptoms of dry eye. This is thought to be due to something called meibomian gland dysfunction, where the use of retinoids can kind of dry up or kill off some of the oil glands around the eyes and lead to dry eye symptoms. And I'm not sharing this because I want to scare you away from using a retinoid around your eyes. For the vast majority of people, it's going to cause absolutely zero issues at all. But if you are prone to dry eye, or you have found that your eyes have been getting drier while using retinoids, it's something worth considering. Now, one question I get is, okay, I'm not going to put retinoids around my eyes. Like, is there value in using an eye cream otherwise? And you'll find dermatologists that sit across the spectrum on this. People who swear by eye creams, people who think they're a total waste of time and money, and then you'll find people in the middle, like me. As someone who has their own skincare line, I have seen the behind the scenes when it comes to the development of eye cream. And what I can tell you is sometimes it's a glorified moisturizer, and sometimes it really is formulated in a unique way to be more beneficial or easily used around the eye without causing irritation or other problems. I have been using or testing eye creams for well over a decade, and I can tell you I've also had kind of that experience where some just feel like a moisturizer or they don't do anything different from a moisturizer, and some truly do feel special to me. My holy grail eye cream is by NeoCutis. It's their Lumiere Firm Tightening Eye Cream. If you've watched this channel for a while, you know it's my most recommended eye cream, and it's because I'm constantly putting eye creams up against this as the test, and no one's really beating it. I find this to be a super nourishing eye cream, and I like it a lot because it not only helps with my fine lines and those early crow's feet, but it also helps with my dark circles, which is something I also struggle with. And I totally recognize it is very spendy for a skincare product, but it also lasts me so many months. I probably only buy this 2 times a year. So those are all the things you can do at home, not only to prevent crow's feet, but also to provide some correction. But let's talk about in-office treatments. I really think about what you're doing at home as something to maintain the skin around your eyes, and something that you're doing in the office is more to reverse those signs that you're already seeing there. By far and away, the most effective thing you can do for your crow's feet is Botox. Botox, or other neuromodulators that sit in this category like Dysport, Jeuveau, Daxxify, and Xeomin, all work by relaxing the muscles around your eyes so that when you smile or when you squint, you do so but with less intensity. By reducing how much that muscle around your eye is contracting, that overlying skin will not be wrinkling or crinkling as much, and over time, those crow's feet are not going to become as etched in. And one question I often get about this is, okay, am I using Botox in a preventative measure here? Like, am I starting Botox here before I ever have any crow's feet etched in so that I never get them? Or once I have crow's feet, does doing Botox injections even help at that point? And the real answer to that sort of lies within the personal preference of the patient. For example, if you have someone in their 20s or 30s who has very healthy skin around their eyes and 0 visible crow's feet at rest, but when they smile, you can see a lot of wrinkling and crinkling around their eyes, they may want to tone that down with Botox. And in that case, they're not really getting Botox to prevent the lines from forming because they haven't shown any evidence of that yet, but really to tone down what their expression looks like when they're animating. Now that will serve a preventative purpose, because if those lines are always relaxed, those lines will never get etched in the first place. But in general, when I'm trying to guide someone about when to start getting Botox for their crow's feet, I tell them to look for the little lines starting to form when they're not making any movements. And when they start to see those lines, that's when I like to recommend Botox in that area. Now, on the other end of that spectrum, I will often have patients in my clinic who are in their 40s or 50s or 60s for their first ever cosmetic consultation, and they're really bothered by their crow's feet that are there at rest. And for many of those people, even if those lines have started to get etched in, they are still reversible at that point if they start getting Botox. And they may not be 100% reversible, but let's say you have some moderate lines there. If you start getting Botox consistently there, let's say 3 times a year, which is pretty average for a patient, then every time you smile or squint moving forward, you're not going to be crinkling or wrinkling that skin as intensely, and those lines have an opportunity to correct themselves a bit. So many times the conversation I'm having with my patients is, okay, we understand that your lines are not that bad now, but if you don't do anything about them, they will be significantly deeper 10 years from now. So what you're doing in this clinic is not just going to reverse some of the damage that we're seeing, but it can also prevent some of those lines from getting worse moving forward. And the reality is, I think it kind of looks weird if someone has absolutely 0 crow's feet and they're 60 years old. Those are really important lines to show that we are genuinely smiling, that we enjoy our day to day. So again, the goal is not to get rid of them entirely. The goal is just to soften them to give a more relaxed and less intense appearance. Now, I do want to illustrate one point about crow's feet, because some people will have crow's feet that start to radiate very low down on the cheek. And some of those lines are due to the actual muscle around the eye contracting, which can be addressed by Botox. But some of those crow's feet are forming merely due to the elevation of the cheek, and the cheek essentially smushing that skin upward. The reason it's really important to make that distinction is because when you're treating someone with Botox, you can only treat the lines that are due to the muscular contraction around the eye. And so not every part of the lower crow's foot on someone can be treated with Botox. I also think you have to be really careful about treating those lower crow's feet, because what you don't want is to have 0 animation around the eyes and then this big cheek elevating, creating this shelf-like appearance. And sometimes you see that and you'll notice someone's Botox looks unnatural. So I like to have a very light hand when I'm treating the crow's feet, because I'm trying to soften them but not eliminate them entirely, and to keep someone's expressions looking really natural. Now, there are other cosmetic interventions that you can do to prevent or eliminate crow's feet, but I really wanted to talk about Botox first because it truly is the most impactful and the most important. Anything else that you're doing to your crow's feet, whether that's filler or laser resurfacing or microneedling, all things I will get to in a second, those only last if you continue to do Botox, because no matter how strong or how fortified or how resurfaced you make that skin around your eyes, if you continue to make that muscular contraction when you smile or animate, those lines will come right back. And I'm mentioning this because it's not uncommon for a patient to come in for a cosmetic consultation and say, listen, Dr. Ellis, I don't like my crow's feet. I want to do laser resurfacing, but I don't want to do Botox. But the reality is you can do that laser resurfacing and not get Botox, but your results won't last very long. So let's talk about laser resurfacing for the crow's feet. I find that the most effective lasers in that area are ablative lasers like CO2 or erbium lasers. Non-ablative lasers like Fraxel can be helpful, but they're a lot more gentle and you get a lot less tissue contraction and tissue smoothing when you do that. However, I will say getting CO2 under your eyes is a big deal. I see it talked about all the time on TikTok, like, oh, I just went and got CO2 under my eyes. No, that is not a casual procedure, and it's kind of cavalier, in my opinion, to see people in their 20s or in their 30s getting CO2 around their eyes. That is a super serious procedure, and it can have super serious complications if it doesn't go right. The goal with these laser resurfacing procedures is not just getting the tissue to contract, but also to get some tissue remodeling and new collagen formation to refortify that skin. If someone's not a good laser candidate or they don't want to do a laser, there are other resurfacing options for them. For example, microneedling and radiofrequency microneedling are popular in my practice, as well as things like chemical peels. And each of these procedures has its unique set of benefits as well as risks, and it's always really important that you're discussing both the benefits and the risks with whoever's performing the procedure for you. Now, aside from Botox and resurfacing, there are other types of injectables that you can do around the eyes to help with the appearance of crow's feet. One of those is PRP, also known as platelet-rich plasma. Another version of this is PRF, or platelet-rich fibrin, but you are essentially extracting growth factors from your own blood and getting those re-injected to the skin around your eyes to fortify that tissue. This is actually a pretty popular procedure in my practice because a lot of patients are hoping to enhance the skin around their eyes, but they maybe don't want the downtime and the risks associated with intense resurfacing, and they're okay with more subtle results that happen over time. You can also use traditional hyaluronic acid-based fillers directly into the crow's feet if someone has a very deep etched-in line. But again, I will say that you should not really be doing filler if you're not also doing Botox hand in hand. Lastly, crow's feet can certainly be helped by surgical procedures. So for example, a lower blepharoplasty, also known as lower eyelid surgery, can be used to go in and remove some of that excess and sagging skin around the eyes. Therefore, it gets tightened up and it's less wrinkly. This is pretty extreme, and I wouldn't do this just for crow's feet, but facelifts and brow lifts can also help with crow's feet because you're removing some of that redundant skin and tightening up those deeper structures in the face. Addressing someone's crow's feet is certainly not a one-size-fits-all, and what I can tell you from treating crow's feet for many years and also working with patients in all age ranges is the more preventative and proactive you are about your crow's feet, generally the better. I'm curious, have you tried any of these products or treatments? Please share your experience in the comments. I love reading about what you're using and what you've tried in the past. As always, thank you so much for being here. Don't forget to give this video a thumbs up and subscribe to the channel, and I'll see you next time.